All right, so topics for questions. So doing practice questions for exam 1, right? So hepatitis. So what kind of hepatitis questions do you want? Hep A, B, C, or just differentiate them? All right, so let's differentiate, right? Hep A versus B versus C, right? So you want medications, you want causes, treatments, because again, that's how the question is going to be formulated. Whether it's what causes it, what the treatment is, what the symptoms are, what the diagnostic test might be, what the complications could be, and then of course the nurse interventions. All right, so causes, right? So you just want to do one of each.
Yeah.
Symptoms, right?
Let's just have the test.
Symptoms, diagnostic tests, right? And you have complications or treatments, which is meds, right? Meds, and then really do non-farm, then farm, then surgery, but there's no surgery for hepatitis, right? So treatment, and then we have complications that might occur, and then we have our nurse interventions that weren't covered elsewhere, right? So you want to do what kind of question first?
We'll do
causes first, right? So hepatitis, which let's just say hepatitis B causes, right? So question mark, right? So SATA, all right. So let's put down some stuff. Let's put I don't know, hand washing, or let's put causes of salsa, all right? Questionable. Okay, we have what else? We have IV drug use. Okay, we have a contaminated bed sheets with stool. Okay, and give me some other ones. Shamu. Shamu show at SeaWorld. Status post. Defecation. Right, and splash zone. Okay, and then let's say we got needle stick injury. Okay, so which ones are it? So they go down the line, right? So A, B, C, D, E. Which one's which? So the rational A, why is it wrong or why is it right?
A is not correct because it's more for Hep A.
This is Hep A, okay. Yeah, right? Because what is Hep A? Hep A caused by contaminated, or technically just caused by fecal oral, right? Transmission. Anything fecal, anything hepatitis, then it's Hep A, right? Hep B, Hep C, they are always what? Blood and secretions, right? And blood primarily is Hep C, but secretions can also be Hep B. Okay, all right. So then B, IV drug use. What is that?
Because they're not always the most sterile.
Correct, right? So this is Hep B, right? Caused by, right? So blood and secretions. Note this also is Hep C, right? Because again, this question could just say hepatitis C causes, right? So that would also be the correct answer for Hep C. Okay. The reason we do this because this could easily say Hep A causes, and that would mean B would be wrong, right? So that's why you do as many practice questions as possible, so you can kind of see the different angles it could be asking, right? All right. Does that make sense? All right. So then contaminated bed sheets with stool. That's Hep A, right? So that's fecal oral. Hep A, right? And then D. Hep A. Okay. Refund your tickets, please. Okay. And then Hep E, needle stick injury. Hep E. Option E.
Correct.
That is correct, right? So this is Hep B. Right? Also Hep B, C. Right? Does that make sense?
Yes.
Any questions on the causes for Hep A or B, C, or C? All right, Hep D or E? The only question I would ask is like, which one does it piggyback off of, right? Or like the fecal oral route, right? Is which hepatitis is, right? Which would be the vowels, right? So the vowels affect the bowels. So it'd be Hep A, and E would be your, like for a SATA question, right? Or if there's like a multiple choice question, you're like, where's Hep A? It'd be Hep E, right? And same thing with Hep D. Hep D is also has to have Hep B present. Okay, hepatitis B causes, and then let's do the next one. So let's go ahead and bold this one here so we know which ones are correct. Okay, so Oops, to Hep B here. All right, so then next one, you would do the symptoms. So you had causes, you want symptoms. Hepatitis, which one?
Okay.
C symptoms. All right, so A symptoms makes more sense because why? No, they have the acute symptoms, right? So A for acute, so they have acute symptomology, whereas at B and C rarely have a like acute presentation. If they do, they'll have the same kind of presentation of flu-like symptoms, et cetera, et cetera, et cetera, right? Which we'll talk about right now, which will SATA, right? But then Hep B and C though have what characteristic? They are not acute, but the chronic, right? So they have chronic complications, right? So they are going to present 20, 30 years later with cirrhosis symptoms, okay? And it's not wrong to say this, right? Because cirrhosis has jaundice and so does acute hepatitis, right? So you can say jaundice. What else can you say? Or do you want to give options? Do you want me to give options? All right, so flu-like symptoms, all right? So let's do epigastric pain, radiating back, right? Let's say positive Chvostek sign, all right, and positive or negative ultrasonographic Murphy sign. Okay, so what are the options? Jaundice is correct, right? And you don't come up with the rationale here if you know, right? So that way you can get it every time, right? So correct. Why do they get jaundice? So no, I don't want to know the answer. Just tell me the right answer, right? You're right. Liver inflamed, right? Biliary tree. Also, squished, right? Squished, and Billy can't get through, right? All right. So if you need a picture, you can throw a picture in there, right? So hepatitis biliary tree. We have ChatGPT to make a picture for us too. All right, so that kind of works. All right, you got hepatitis. That's small. It's a low resolution picture. It doesn't fit my OCD. All right, so let's go ahead and copy the image there. Let's throw this guy in there, right? So that's huge, but actually I can do this. Let's insert a drawing. Drawing. Faster. There you go. Okay, so then this guy, and then you can have like some highlights here. Let's make it red, and let's draw on the screen, like drawing, and draw. That's drawing, right? It's not drawing. Scribbles. All right, so then it's, I want blue, I want red. All right, so it's squeezing on the biliary tree. Does that make sense? All right, so it's squeezing there. I want more thickness here. All right, oh. All right, so there's no good notes. I want like calligraphy style or something. That's not working. Not working great. Anyways, it's squeezing, and therefore, oh, no, don't make that green. Okay. All right. How do I make a new line? All right. So this isn't working out. All right. I should be drawing it in a different program. Okay. So then your biliary tree, everything's trying to get through to the intestines here, right? Let's make that nice and green now. All right, there's our green lines. Make it thickish. Oh, whoa. All right, so that is the bilirubin trying to get through. That's being processed by the liver. And so the liver is inflamed. It can't get through. All right, so there's that.
People are gonna see that and be like, what?
Okay, so that's why you have elevated bili. It just doesn't get through to the bacteria, so your urobilinogen goes down too, right? All right, so then B, what was B? Flu-like symptoms. Yes, correct, right? So hepatitis A is a virus causing viral symptoms, right? So viral symptoms are, let's just think about whenever you had a virus, right? Unless you're like a perfect immune system, you'd know that you had fever, you had myalgias, you had muscle aches, you had arthralgias, joint aches, etc., right? And you can put those here, right, if you don't know what those are, because this could easily be a different one. And we'll change this to a more critical thinking question, All right. So then what else? C, epigastric pain radiating the back.
Yeah. I would pick it on the test.
Nope. All right. Okay. And why is it a nope?
I wasn't sure if it's epigastric or is it like lower?
Where's hepatitis pain at? Good. It's right upper quadrant, right? So it's epigastric pain that radiates the back is what? This describes. Good. Pancreatitis, right? Right. This is not hepatitis. Hepatitis has pain that is right upper quadrant, right? And may radiate to right shoulder and back. But definitely, fidelity, perfect. Definitely right upper quadrant. Okay? So you want to put the rationales here, right, when you're going through questions. Otherwise, it's, because easily it can ask another, say, pancreatitis symptoms, right? You're like, well, jaundice, does pancreatitis have jaundice? No. Does it have flu-like symptoms, pancreatitis? No. It has it has fever, but it's not going to have like mild, like I've been feeling weak for the past week. No. It's pretty quick in onset, the last 3 days, 4 days or so, and they feel really, really bad. Febrile, it's like not bacterial, but it's a huge body-wide inflammation. Okay? And then epigastric pain radiating the back, yeah, that's pancreatitis. Positive Chvostek sign, is that pancreatitis? We're doing like 2 questions at once, but it is, right? So because this is a nope, right? This is a sign of, so this is a sign of what? What is Chvostek? Hypocalcemia, right? Which can be a symptom of acute pancreatitis, right? Right? And this, remember, hypercalcemia causes acute pancreatitis. So they're in sometimes it's like which side of the fence, which one caused which. It's the high calcium causes acute pancreatitis, and then acute pancreatitis in general can cause low calcium levels. Okay? If you don't know the rationale, the rationale can help you understand why it is, right? Do you have to know the rationale for the test? I'm going to ask you, was it because the free fatty acids were digested by lipase, they leaked to the bloodstream, and therefore the free ionized calcium bound to it, and therefore your calcium level is low? No, that's not what I'm asking you. What I'm asking you is it low or high, right? So you could memorize it, but again, there's like 500 things to memorize, okay? So then E, negative ultrasonographic Murphy sign. It's not pancreatitis.
Wait, that's the Murphy's? Yeah, isn't that the... What was in last week's lecture? Last week was Murphy, right? Yeah. So yes. No. But wait. I thought Murphy's sign was just like it's not an ultrasound thingy. Didn't it have something to do with the diaphragm? Yeah. Like they can't breathe? Yeah. But why? Can they not take a deep breath? Is that hepatitis?
Murphy sign and hepatitis, do those go together?
No.
They do. So when you have a Murphy sign, that is hepatitis. All right, there's a sign of hepatitis. Right, so that's basically just right upper quadrant pain, like you were mentioning. It's when they have inspiratory arrest. You're palpating, and the diaphragm goes down, and it bumps up against the liver, right, and it causes pain, right? So Murphy's diaphragm and liver, All right, so there's a diaphragm. You can see that there, kind of. All right, so let's see if we can do this again.
I don't know how the body looks, so.
So insert a drawing. Let's see if this is more cooperational here. Okay. So when you inhale, what happens to your diaphragm? You say yes?
What happens, yes?
So let's do blue for it. All right, when you do what? When you do inspiration or expiration, does your diaphragm go down? Inspiration, right? So inspiration, let's make that nice and different colors. Do impact, sure. Right? Inspiration, let's make the color blue. No, don't fill it in. Let's make it no fill, transparent, and color. There it is, blue. Okay, that didn't work at all. All right, so that's All right, that works. Okay, so you inspire. That's going to cause some pain, right? That's because the diaphragm, the liver is inflamed right here, right? So here is, if this works again. All right, so this is an inflamed. Okay, this is not functional. All right, so then you got an inflamed liver, right? So this liver, I need a more inflamed liver. There we go. That looks inflamed now. All right, so you got an inflamed liver, right? That is hepatitis, right? It's hepatitis or itis. It's inflamed itis, right? And it's the liver, and it's all inflamed. And then when you have inspiration, that's going to cause a damaged liver, or not damage, it's going to cause symptoms, right? And some guy named Murphy in the 1800s, I assume, 1900s, he discovered that that's what it is, and he put his name in the textbook, right? So it's called Murphy's sign. Okay, and it's going to hurt when you put a hand there or you put a ultrasound there. Okay, but what do the questions say? A negative, right? So negative, that's going to be a nope. Okay. Oops. A nope, right? It's a positive Murphy sign. Okay, does that make sense?
That goes for any of the hepatitis?
Mm-hmm. Yeah, it's going to be Hep A more commonly because Hep A has the acute phase, right? When you have cirrhosis, your liver is like super tiny, like a raisin, right? It can be, it's not going to cause pain when your diaphragm goes against it, right? So the liver is this shape, right? And it's only going to get bigger with hepatitis. And of course, it's going to get bigger and more inflamed, it's going to hurt. Whereas in cirrhosis, it gets smaller. So you can inhale a lot and it's not going to hurt, right? All right, does that make sense? So let's copy our template here. So that's Hep A, hepatitis symptoms, and you want to do diagnostic tests? Okay, so hepatitis, which ones? C, diagnostic tests, right? Question mark, right? So positive CEA, positive AFP, a positive GGT, a positive RNA PCR, right? A positive, IgG. Which one?
Well, Hep C is RNA.
Good. So I'm going to go to that one first, right? So yeah, so correct, right? Because, right? Hep C is RNA, so is Hep A, right? Hep B is DNA, right? Because this question could easily say Hep B, right? And then that could be DNA or it could still be there, right? And you would not choose it if it was Hep B a question, right? So I didn't highlight the one up here, so these ones are correct. Oops. It's not like Microsoft Word where you accidentally paste something and it crashes the computer. All right, so Hep C, diagnostic tests, right? So positive CEA, what is that?
It has a C in it, so I would.
Has a C, must be Hep C.
He's like, nope. I know. I'm sure it's not correct, but I would think because it has a C. What's the GGT again? I feel like that has something to do with it. I just can't remember what it is.
So usually in the test, I'm going to give you the full thing, all right? So it's carcino embryonic antigen, I think. Carcinio embryonic. My medical terminology is not.
No for that. Yeah, I must say no. Now that I know what
Right,
it is.
and this is like, what is AFP? It's alpha what? Fetal protein, right? AFP, and again GGT, gamma glutamyl transferase. We're not going to spell out RNA or PCR, polymerase chain reaction, right? So CEA, what is that? Is that Hep C? No, right? Nope. All right, so what is it?
Something for cancer.
Yeah, cancer of the, this is for cancer of the,
CI? Oh, the coin. I don't remember this one. You don't remember that? I do not. Ricardo. It have to do with the stomach?
Gastrum or esophagus, right? So esophageal gastric cancer have CEA positivity, right?
The coin would help. Yeah.
There you go, the coin. All right, so then alpha fetoprotein.
I was like, what coin? Okay.
What's alpha fetoprotein for? Is that Hep C? Hep A? No. It has an A in it. It must be.
It must be it. This is why we need help. Saying it over and over is not going to help me, but I'm going to do it anyway. Is that also for cancer?
Correct. It's for cancer. This is for cancer of the liver, right? Yeah. So it's liver related, right? Hepatitis is liver stuff, but it's liver cancer. You're gonna have a positive AFP. Okay. And C, positive GGT.
I would pick it, but I don't know why.
So that's a nope, right?
That's for pancreatitis?
Pancreatitis? No. I mean, you can argue that it could be in pancreatitis, right? But this is positive when bile duct is inflamed, right? So that'd be, choledochos, maybe pancreatitis, if due to gallbladder, gallstone, right? Which is choledocholithiasis. Okay, so D we said was correct. What about E? Positive IgG.
Feels wrong to only have one correct answer. I would pick it just because.
You pick it just because we only have one correct answer so far?
Unfortunately.
Yeah, usually I don't do that to you, otherwise it's a multiple choice question, right? And I don't think ExamSoft lets you. So that's just a tip. You're taking a test on ExamSoft in the nursing program and it says SATA and there's only one option correct. It has to be two. Okay.
So then that was
So yeah, but that's not in real life though. If you're like doing like.
It's like in real life I would do that to you though. So.
All right, so positive IgG is correct. Why is it correct?
Oh, because no. Is that immuno?
This is antibody or antigen? I'm already typing it, right? So this is an antibody, right? That floats around, all right? And they are specific to a disease process, a pathogen, I should say, right? So there's a Hep B, there's a Hep C, there's a Hep A antibodies, right? So that's how you know someone's infected. So they have the antibodies for it, right? I mean, to be more complete, I would say the IgG, for Hep C, right? Or I'd maybe say in a STEM, Hep C diagnostic test, you would see positive, right? You see a positive IgG for Hep C. Does that make sense? You would see a positive IgG for Hep B, but there's like 4 of them, right? There's envelope core, right? There's the surface. There's all the different antigens or antibodies that are present, right? Antibodies are either IgG or what? Are either IgG or IgM, right? IgM is acute, IgG is chronic, right? So yeah, if they have a chronic Hep C, you're going to see the IgG for Hep C, right? If they have chronic Hep B, you're going to see the IgG for Hep B as well, right? And it's like which one, surface, envelope, or core? It's like it's going to be present, right? I'm not going to differentiate all 3 of those for you. I'm not going to say, oh no, it's like they were infected but aren't active infection. It's like no, they have the IgG or IgM, or they have the active infection, which means they have antigens present, right? That means you're actually seeing the antigens of the actual virus present, right? Does that make sense? So what antigens versus antibodies are? Right, antibodies stay in the system because they're being made because they've been exposed in the past, right? Yeah, titers are looking at IgGs, right? IgMs only last maybe 3 weeks, maybe 6 months. We don't know, right? So it varies on the disease process. All right, does that make sense for diagnostic tests? Or do you want to keep doing hepatitis, or do you want to move on? So we did causes, we did symptoms, diagnostic tests, so treatments, right? Let's grab our template up here. Okay, so hepatitis what? Hepatitis C treatment, right? And let's put some stuff in there, right? What are some treatments? Put interferon, right? We could put lamivudine, tenofovir, I think is one, right? And we have sofosbuvir. I can't spell it. It's Fubar. Sofosbuvir, I think. Okay. Thank you, Google. All right. Sofosbuvir. All right. And what's the other one? Hmm? Ursodiol. Okay. So let's go through it. So A, interferon. That is true. All right. So correct. Yeah, you do want to look at static questions, true, false. But so that is a true statement, right? So interferon is correct, right? This is given for Hep C and, right? Which other one? Hep B, right? It's not for Hep A. Right, so it said Hep A treatment. This would not be a good Hep A treatment question because we'd have to add a Hep A treatment on there. Right, there's nothing on here that's for Hep A. All right, but Hep B versus Hep C it could go either way, right? There's two questions in one. This could be Hep B treatment or Hep C treatment because there's options there. So lamivudine, is that for Hep B or Hep C? Or not at all? So this is a nope, right? For Hep C. Okay, so Hep C treatment, lamivudine, that's nope, right? This is for Hep B. Latte, son. All right, and then what is C? Tenofovir. Right? Nope. Latte. Did I stutter? Okay, and then D. Yes. So that's a correct because not in latte, right? All right, so then what is latte? Just so we know what it is. Lamivudine.
Tenofovir is the T. Yeah, it's the T. One of the T's.
T-E, right? So we'll fill that out, okay? So those are things you want to know, okay? Just so you can recognize. And well, the nice thing is that in Hep C, it's not something you have to memorize because the letters are just only unique to Hep B. There's no Hep C treatment that starts with L, A, T, T, or E, okay? So that's the nice thing is that it's either latte or it's not latte, okay? If it has what suffix tells you it's for hepatitis. It's the vir, right? So the vir is kind of cluing you in, right? That's for hepatitis. This one doesn't, unfortunately, follow that that one. I think is entecavir, right? Is this one entecavir? All right, so you can see the avir. That's for a virus, right? So like sofosbuvir, right? Whoops, I did this wrong, didn't I? Tenofovir. I'm getting confused. Sorry. So latte. Let's put latte up here. Okay, latte, son. Okay.
The T is talbivudine.
Talbivudine. Yeah. So these are guys that are not latte, right? So not in latte. So Hep C treatment does not start with the letters L, T, T, or E. Right, and you can put a few of them in there. All right, so sofosbuvir is a popular one. There's a few other ones that are popular, right? So where was I going with that? So sofosbuvir, right? So it ends with the vir. Okay, it makes you know that it's viral. Does that make sense? All right, so E, ursodiol. It's like ursodeoxycholic acid or something like that. Ursodeox, say if it corrects me. Oh, It was almost going to do it, unless I spelled it right. All right, so right is for Hep C or Hep A or Hep B. It's not in latte, so is it correct? That's a nope. All right, so it is not for Hep C, Hep B, or Hep A.
Oh, it's not for hepatitis.
It's not for hepatitis, right? It's for pancreatitis. No.
What is that? It was with the cards. There was a bear. A bear? Yeah. You don't remember that? Oh, the playing cards? Yeah. In which?
Derived from bear urine is for.
It's not hepatitis. What else do we do? The stone. Choline. Yeah.
Cholelithiasis, right? So cholelithiasis for gallbladder, right? So on the test, again, there's going to be options that are across the different sections, right? So you have medications that are across different sections. You have diagnostic tests that are across different sections. Treatments that are across different sections. You have to differentiate that, right? So it's the same thing when you go to your patient and you have to go to the MAR and there's like 10 different medications. You have to tell them this one's for your gallbladder, this one's for your hepatitis, this one's for your cholesterol, this one's for your blood pressure, right? That's the idea. Okay, and the other thing is you have to know the side effects, right? For these ones, for these Hep C treatments, I'm not making you know the side effects, right? They are rare enough, and again, up here in the Antelope Valley, how many people can afford a $180,000 treatment? Not many, right? They're living in Quartz Hill maybe, but they're not going to be, or Hanna Verde, right? They're not going to be on this medication commonly. When you see it, it's like, oh, cool, I know that one, right? So that's one of the lattes. Look at that. Okay.
The A is adepavir.
Adepavir. Like that?
No, with an F.
Adefovir. Okay.
Is that supposed to be an L?
Yeah, I'm not sure what happened. I was thinking Hep B, I think. All right, so let's grab another template up here. And are you good on these ones? All right, so treatments. All right, so nurse interventions, that's where a lot of teaching is going to be, and that's I think guaranteed to test questions. You want to do that one?
Yes.
All right, so hepatitis which? A nurse intervention, teaching, right? That's a nurse intervention, is teaching, right?
Is it B instead?
Do you want a B or A? We've done C, C, A, B. So C's been twice, and we got A or B for this last one. All right, Hep B teaching, right? And this is pretty much just like causes. It's just reversed, right? So let's actually, sorry, let's change your thing because we did Hep B causes. Let's do Hep A causes, right? And literally we just copied that question, right? It's exactly the same. And sorry, I was gonna, before we go on to that, let's go back. I was gonna actually I was gonna take this one, Hep C diagnostic tests. Let's do this. Let's make this. Was that the one? No, I was gonna do symptoms. Sorry. Let's go back to this one, to symptoms, just so you can, Hep A symptoms. So it'd be the same question, right? But we're going to do different answers. So we're going to make it more critical thinking level answers, right? So let's grab these. Okay, and let's take away that. Okay, well actually it's the same answer, right? So we're just going to make these fancier, right? So when you read your charts, you read your concept maps, you read your notes, it says jaundice, but do you know what that means, right? So that's the idea. All right, so give me a symptom of jaundice that a patient might even complain of, right? Patient Hep A symptoms, a patient, or reword this, right? The patient comes back positive for Hep A, right? They state, I don't know.
They're itchy. Their skin is yellow.
I'm trying to reword this. I mean,
They state the following symptoms.
yeah. Looking back at the H&P, right? H&P, the nurse notes these elements, right? It's like in highlights, right? The symptoms that are complaints. We're just making this up on the fly, right? You know the highlight questions, you have to highlight, right? You highlight HPI, like what clued you in, that was hepatitis A, right? That's the complaints of the patient that were Hep A. Okay, so they were saying they were what, right? I was itchy. And I became more tanned, right? And then flu-like symptoms. So what is that? What would the patient complain of? All right, not feeling well is the fancy word for that is malaise. All right, my sour cream and onion malaise. All right, so epigastric pain radiating to the back. All right, so that would be something that you would not highlight. So I'd probably make it just, I don't know, it's hard to mix and match if it's like an HPI, but what would they complain of? What would you say? That's definitely pancreatitis and not gallbladder. It's like I have pain right in my back, right? Because I have a bruising around my umbilicus, right? I have bruising around my belly button. And back pain. That starts beneath my sternum. Okay, so that is clearly pancreatitis, right? And positive Chavoste's sign. What would that look like? My calcium meter is going off, right? Or whenever my toddler hits me with their dump truck. My cheek twitches. All right, and then negative ultrasonographic Murphy's sign. They probably don't have an ultrasound at home, but what would they have?
When I stuck my hand under my diaphragm.
This isn't creative writing class, so I'm not going to fault you. All right, so the negative, I'd probably, again, rewording this question, I would probably, to make this more clearly, I would say ultrasonographic, so you have Murphy's sign, right? So make that a positive answer. All right, so let's just change it up. So let's say they do have a Murphy's sign.
I can't breathe when somebody touches my
All right, it really hurts when I laugh, right?
We're like,
Right, so, and my laughs are boisterous, right, and big inhalations. Okay, to clue you in. All right, so it's the same options, right? It's correct, right? This is a symptom of jaundice. These are symptoms of jaundice. Okay, and then B is correct, right? These are symptoms. These are flu-like symptoms, such as what? So we got fever, right? Instead of fever, I would probably say I feel warm last couple of wet days, right? So I have felt warm with chills, right? And they got achy. That's called what? Myalgia, and they have not feeling well and malaise. Okay. And then I have bruising on my belly. This is incorrect, right? Nope. Right. This is right. They have belly button bruising. That is what?
what's it called?
Mm-hmm.
It's a good question.
Hold, please.
Yes, technical difficulties.
Colon sign.
That's colon sign, right? Colon sign and classic pain, right? That is epigastric. And then D, right? Whenever my toddler hits me with their truck in my face, it twitches, right? So nope, this is pancreatitis. This is hypocalcemia, right? And Chavoste's sign. Okay, and then E, what was it? It really hurts when I laugh.
That's correct.
So that'd be, yeah, so we're saying we change this up, right? So this is correct, right? So because we, yeah, this is a positive Murphy sign, right? Inspiratory arrest due to pain. Okay? All right, so we did change that up from the one up here, which was a negative, right? It's like I'll just say on a real test, on test, I would make positive to make it easier, right? All right, so go back to our hepatitis A teaching. All right, so we can use the same stuff from above, right? We can use exact same things, and that would be the same thing, right? Do not eat questionable salsa. Do not IV drug use, and do not eat contaminated veg, or not eat, but do not. I don't know. Use a blanket that's contaminated, but let's do some other Hep A stuff, right? So Hep B would be what? Hep A, Hep B, C, different options.
Wash your hands.
All right. So wash hands. Right? These could be statements, right? Wash your hands before every meal, right? Wash hands before every meal. That's not going to protect you from the Hep A if the Hep A is in the meal, but it'll protect you if you did not wash your hands after defecation, right? What else would you teach?
Don't go to Chi-Chi's.
Don't go to Chi-Chi's, right?
Isn't there a vaccine?
Good, right? Take the hepatitis C vaccine. Hepatitis, yeah, well, you already said hepatitis A teaching, but hepatitis teaching, yeah, before endemic travel, right? And then what's another one?
Or like right hand, or?
If you had a blood transfusion in the 60s, you should be checked for Hep A. And then what else? If you get a needle stick injury, you need to bleed it and wash hands thoroughly. Right? And then what's E?
Don't IV drug use. Well, if you're gonna IV drug use, do it sterilely.
Yeah.
Don't show your Don't eat raw shellfish.
You can get fresh needles from the community center. Okay. All right. So Hep A it's wash hands before every meal. Is that correct? Yes, correct. Right. And then you can ask, but what if the meal has Hep A? And so this is called risk mitigation, right? So you don't know, right? When you go out to eat at Panda Express or Chi-Chi's or, right, you eat questionable strawberries, you don't know, right? Washing your hands if you just went to the bathroom is going to protect you, right? So that's why you have to trust where you eat. That's why there's food grids as well, okay? So this is risk mitigation, all right? So this could easily say the meal is contaminated too, right? And then B, right? Take the hepatitis vaccine before endemic travel. Is that true for Hep A? Yes, that's correct, right? Hep A can be found in blank when traveling. Where? It could be in the food and the street vendors, right? It's in really the water is what we're worried about, right? So contaminated water, right? When traveling, right? Also food safety, right? And we've seen the TikToks with the food vendors that are cutting the tortillas with for their feet, right? So that can be a problem, right?
Someone about like Paris, near the Eiffel Tower, they make like crepes, but they use sewer water. Crazy. I will not be eating crepes in Paris.
These are all clean. I need a nasty one. All right, food vendor or a street vendor. There's no shirt. That's a good sign.
Oh gosh.
All right. It could be fecal oral. I think the foot one would have worked nicer because the feet, they're walking in the streets. There's people going, oops, no, I need the actual GIF. Otherwise, it's worthless. Okay. All right. So what else? C. Okay. If you had a blood transfusion, right? Is that something that's Hep A related? No. Right. So nope. This is what? It's usually Hep C, right? It could be Hep B, right? Hep C, possibly Hep A. All right. Hep C can be found in those that receive transfusions, right? Blood transfusions before it was even checked.
When you say possibly Hep A, is it?
Oh, yeah, Hep B, sorry.
Okay.
right? And what were the years? It's like 45 to 65, somewhere in there.
Yeah.
What were the years?
They used to just share needles.
Hmm?
They used to just share needles.
No, not really. Didn't just share needles back when it was great, when it was black and white.
What was the one that they just used to like? Wasn't that a thing also in the slides? Where they used to just use needles on each other?
It's 45 to 65, right? Who can confirm? Oh, there it is. What's the years? 1945 to 65, I think. 75. 45 to 65, there it is. Okay? So I even checked those alive during 1945 to 65. All right, they're at risk for Hep C. Okay? So D, if you get a needle stick injury, you need to bleed it and wash hands thoroughly. Sounds good. It has wash hands in it,
Yeah.
right? I mean, this could even say like wear gloves, right up top, right? So this is a nope. Why is it a nope? This is not. This is Hep B, or most commonly, right? Right, could be Hep C, right? This is Hep B, because B is and C are by blood transmission. Okay, good. This Hep B, and what else? The steps are correct for what? What's that called when you for exposure? It's called PEP, right? It's post-exposure prophylaxis, right? You're supposed to bleed it a little bit so that whatever, just like when you slap a patient, when they get IV push, you withdraw, you aspirate, right, for the A. You also aspirate in case there's some blood in there, like snake venom, right? You bleed it out just a little bit, just in case, right? Prophylaxis. So those are the correct steps you would do, right? But that is not a needle stick injury is not related to Hep A. Okay. What about E?
Also no.
That's a nope. Why is it a nope?
Because it's also for Hep B.
This is for Hep B and C, pretty much equally, right? So Hep B and C, and again, you don't have to know which one's equally. It's going to be, it's either Hep B or C usually for anything that's blood related. Okay, secretions is really Hep B. That's really we're looking at contaminated secretions. Okay.
So if the question was for like Hep C, we wouldn't pick D since it's more for Hep B.
So if it was said Hep what again?
Hep C.
Said hepatitis C teaching, would you pick D as an option? Is that what you're asking?
Yeah, like could you? Or would it technically be wrong because it's more for Hep B?
I would probably just ask you Hep B instead, right? Just because I don't want there to be confusion, so try to make it as clear as possible.
But then wouldn't that be the same for C for Hep B?
Blood transfusion, no, that's more Hep C, right? I'd probably change it so it wouldn't be confusing. It'd be, you have, I don't know, you already had a needle stick injury, something else blood related. Okay, does that make sense for nurse interventions?
Yes.
All right, so that took about 50 minutes. Is that but we did a good amount of questions. Okay, do you still want to do EKG stuff and other things? What do you want to look at?
We could just do like a general EKG question or something. I don't know.
So what is general to you?
I don't know. Just kind of like mixing up everything because I get confused on how to differentiate for what.
Okay, like what?
Like treatment causes.
Yeah, it's the same things, right? So it's the same thing you're doing here,
Yeah.
right? So you're looking at what are you doing for this EKG, right? So that's why if you have a table that helps the best. If you have different pages or concept maps for each rhythm, that can help too, right? So you have to be able to you have to interpret rhythm, right? And then assess what the causes. Symptoms pretty much are the same, right? What the diagnostic test, the treatments, complications, nurse intervention would be for the EKG in question. Okay, I mean there could be knowledge-based questions, right? Those are ones where it's like identify is really it's also critical thinking, but more like a first degree heart block has a prolonged what, right? A ectopy would be an irregular or regular rhythm, or a I don't know, this rhythm has I don't know, it has a rate greater than 100, right? Which one of these rhythms SATA has a rhythm greater than 100, right? So it'd be like a junctional attack, and I have, what else? The SVT, we have, AFib, RVR. So that's the idea, okay? It's knowledge-based, right? So there will be a quiz question, right, on test, right? So one of those guys will be on there too, okay? So one of your quiz questions. Okay, you guys are great in the EKG quiz test, so.
Oh, one of the EKG quiz questions will be on it? Okay, I see. And the in-class quiz question. I did good on that.
Good.
I was shocked. I was very shocked.
So you want to do like an example where you have to interpret the rhythm and then figure out what the cause, symptom, treatment, or whatnot would be? Okay, so we have to find a fancy rhythm. So let's find a fancy rhythm. I think I have some EKG pictures here. Let's do pictures, EKGs. Don't look because it's going to tell you the answer. Let's grab this one. Let's put this one, throw this one in here. Okay, you can look now. All right, so then your patient has this. What do you do? Okay, SATA. All right, good. So call, maybe call for help would be good. Would be a good option, but I want you to actually do stuff, right? Calling for help is appropriate, right? It's like, it's like, I think my patient's not okay. All right, that's good, but like, what would you do? What would you expect, right? So let's say do immediate cardioversion, right? Or immediate unsynchronized cardioversion. Okay, so I would do what? What else would I do? Start CPR. Let's just say patient has this and is unresponsive to touch stimuli. Okay, what do you do? Immediate synchronized cardioversion, start CPR, right? Administer what medication? Atropine. Administer epinephrine, right? And let's do another medication. Do another medication or intervention? We have 2 interventions, we have 2 medications. What do you want the tiebreaker to be?
Medication.
All right, so administer what? Amiodarone. Okay. All right, so first of all, what is this rhythm? It's torsades, right? So you have to know that. If you don't know that's torsades, then you're out of luck, right? So you're gonna miss this question. So then immediate unsynchronized cardioversion, is that correct? That's correct, right? Unsynchronized is for what? 3 lethal rhythms, right? Right, which are pulseless, VTAC, torsades, right, and VFib, right? So when you're doing these rationales, you want it to go, because this could easily be VFib or it could be VTAC, right? It'd have to tell you there's no pulse, right? It has no pulse, all right, let's just put that here, and it's unresponsive to touch and stimuli, okay? So it could be any one of these rhythms. So that's the reason why I was trying to get you guys to do rationales and then I just go D, 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 right? That's not going to help you, right? You have to be able. Anybody can, not anybody, but you want to be able to. You can easily guess, right? So, but you want to get the rationale behind it, okay? Because it could easily be a different rhythm. All right. So then B, administer atropine. Oh, sorry. So yeah, B is CPR. Do we do CPR for this? Yes? Question mark? Yes. Yes, that's correct, right? And why is that correct? Yeah, it's unresponsive, but really, technically, if you know your BLS, if someone's unresponsive, and you could do rescue breathing, right? The fact they have no pulse really clues you in it's time for CPR, right? So correct, there's no pulse, right? Always no pulse, CABs, right? And that is what? Compressions, CPR, and airway, and then breathing, okay? So really, we're testing you on compression and CPR. That's really the priority, right? So there's no pulse, all right? This is for any rhythm without a pulse. I already say that. Rhythm without a pulse. All right, because when there is a pulse and there's lethal rhythm, you could like go back and forth. Is like if there's like pulse VTAC with a pulse or VTAC without a pulse. But no, when there's no pulse, it's automatically CPR, right? Automatically CPR and what else? Is for any rhythm without a pulse. Right? So CPR and epi for every single rhythm that has no pulse, right? There's no exception to that. Okay? Whereas, you don't do CPR if someone has a pulse and a low blood pressure, for instance. If the patient had a low blood pressure, I would not do CPR, right? The fix is to fix the underlying cause, which is always the right answer. But what is the right, can we give epinephrine? That's what I said right here, right? Is that correct, right? Sorry, I keep skipping, sorry. Let's just put that down here so we don't forget, right? Right, CPR and epi is needed for every rhythm without a pulse, without. Okay, and then C was atropine. Do we give atropine for torsades? That's a nope, right? And why is it a nope? This is for?
Okay.
Which one's atropine? It's when you're IV push cardiac meds.
Please hold.
I'm going under a tunnel, hold on.
I'm putting a friend. Is an anticholinergic. For bradyarrhythmias.
Is for bradyarrhythmias. Not fast ones, all right? And definitely not lethal ones, right? Such as torsades, all right? So atropine is for slow rhythms, right? And there's a certain point where it just stops working, right? When the AV node is broken, all right? Like a third-degree AV block, junctional idioventricular. All right, so that's a nope. What about E? Give amiodarone. Is that a nope?
No.
No, it's a nope, or no, it's not a nope?
No, it's a nope. I think that it is a nope.
It's a yes nope, no nope.
No.
It's a no nope, which means it's correct, right? So it's a correct, right? Why it's a correct answer because amiodarone is indicated when you have a torsades or ventricular arrhythmia, right? Remember we have ABCD drugs, right? It's the only one that's also for ventricular rhythms, right? Correct, right? Amio is for ventricular, right? And atrial. Okay? So amio is for ventricular rhythms, right? So VTACs, right, and VFibs can get amio. Okay? And next semester you'll learn about when, right? You just know that amio is given, and technically it's after the third shock, but it's really your goal right now is to know that is a treatment for lethal ventricular arrhythmias, right? Not asystole, not PEA, because those are what? They only have two treatments, which are CPR and epi, right? Technically, you can put a little asterisk on that because the treatment is, fix the H's and T's, right? Fix the underlying cause, right? But that is, these are the correct options here. All right, does that make sense?
Yes.
All right, do you want to do another one?
No.
Okay, so this is looking at what? These are treatments, right? What do you do? What's the treatment? What are the interventions/treatments, right? Whereas the question could easily ask, what are the causes, right? And the causes would be what? What did I just say? Yeah, so torsades has these things and a few other things like R on T phenomenon, and you have prolonged QT and electrolytes that are low, but also there's every lethal rhythm has what causes? H's and T's, all right? So it could easily be A, B, C, D, E, and you have three H's and two T's, or two H's and three T's, right? It could say H. pylori. It's like, nope, that's not. That starts with an H, but that's not one of the causes, right? You could say tenofovir. It's like, no, that's not one of my H's and T's. Okay, does that make sense?
Yes.
All right, you're good in EKGs, or?
I hope so.
All right, so.
It's okay. We'll just move on.
Okay, so we did EKG stuff. We did hepatitis. What else? What else are you feeling? Hernias?
Just go down the list.
What kind of hernias? What are the hernias you have to know? Hiatal.
Like, wait, no. The how do you spell it? Inguinal?
So yeah, you got the abdominal ones, right?
Okay.
Right, abdominal, inguinal ones, right? So you have like the ventral, you have the femoral, inguinal, you have the, what's the other one? You have incisional one, right? Midline. I think that's kind of ventral. Anyways, you have the different hernias, right, that pop out of the abdomen. You have the one that pops up through the hiatus, right? And you have another one that pops out where? You can kind of consider it. It's really pop out of a blood vessel, right? And then, but you do have pop out of the tissue. When you think of like diverticuli, right? And hemorrhoids. I kind of think of them all. I kind of all built together. Okay, so we'll go over these guys here. All right. So which one do you want a question on? And it's the same thing. What are the causes? What are the symptoms? Right? How are you going to fix it? What are the treatments? And any interventions you're going to recommend? Okay, don't get surgery, right? It would be an incisional recommendation, right? Or you do what? You tell them not to what? You wear splints and not to get pregnant. I don't know. No, to heavy lift to increase intra-abdominal pressure, right? So let's go down to hernias, right? So it's actually, sorry, let's close your eyes so you don't get vertigo. Let's grab the template here. Okay, so then which one you want to do, like planal hernias or hiatal hernias? What do you want to do? So let's do hernia, what? Causes, symptoms, treatments, diagnostic tests. Really, the only diagnostic test is like, you do a CT, you go, oh, look, there it is.
Wait, can you do an EGD also, or no?
EGD for hiatal hernias, yes.
Which kind would you put? Causes? Sure.
What about complications?
Okay.
So, why do you even ask me for my input, right? Hernia complications, right? And let's throw let's make it spicy. Let's say, okay, it's a femoral, right? Inguinal. And you can put symptoms there, right? It's dull, achy pain, right? Right? And not able to be put back in abdomen. Okay? And then complications. What are the complications? So let's say we have a hematochezia. I have chest pain and shortness of breath, right? I have, what's the word? I have, what else? There's some other things,
Hypotension and confusion.
Yeah? Hypotension, confusion, but
Just finishing up the song. Isn't it no. Well, hematochezia is coughing, right? Oh wait. What? Isn't hematochezia? Is that the only thing? Is hematochezia the rectum?
mm-hmm.
Oh, okay. Hematemesis.
Complications are,
But is that,
let's get rid of this. Let's put this as an option. To push intestines back into abdomen, right? And then we can have, what else? You can have bowel ischemia. And what's another one? You can have
strangulation. Is that a complication?
all right, bloody diarrhea. Okay. So what's hematochezia? Is that related to hernias or not? That's a nope. Why is that a nope?
Because it would take time.
This is bright red blood per rectum, right? So this is bright red blood per rectum, and again, hernias are, for one, hernias are of small intestine, not large intestine. which would cause bright red blood per rectum, hematochezia, right? Also, right, you may have melena, right? Right, if bowel is dying, right? But it wouldn't be, but not bright red blood per rectum. Bright red blood per rectum. Okay? And then, but what does have hematochezia? Could have hematochezia, right? Usually blood streaked stool, described as blood streaked, right? With bright red blood, but it's not like bright red blood where it looks gushing, right? Where my anus is bleeding, right? What's another something else that has hematochezia? Prominent with GI bleeding is prominent with GI bleeding. Yes.
Oh.
Hematochezia is prominent with. Cancer is going to be a slow bleed. It's not going to be a prominent, a fast bleed. And slow bleeds are melena, right? Fast bleeds are hematochezia. Or bleeds that are where? Anatomically.
Oh, diverticulosis.
Bowels. Perfect. Those are adhesions, which cause hernias, actually. All right, so put that guy in there. Let's try this drawing again. This never works. Insert drawing. Let's make a quick drawing right here. So we'll be able to scribble. It's asking too much. All right, so if you have a shape, right? Let's do this one. If you have a bleed over here, right? Let's make that transparent, no fill, transparent. Let's make that red, and let's make that thicker. Okay, if you have a bleed there, that's going to be a bright red blood per rectum, right? Including the rectum. Okay, if you have a bleed anywhere else, let's kind of copy this. Perfect. Okay, let's make that nice dark and stool-like and melena-like. Okay, let's go all the way down here. Let's do that one. Okay, so that's where you're going to have melena, right? If it's in the small bowel or it's in the it's on the ascending colon side. Okay, so that's where you have melena at. And where else to go with that? So if you have blood bleeding over here on this side, right? What bleeds over here? You said it before I started the drawing. You have diverticulosis, right? Not diverticulitis. Okay. With diverticulosis, not diverticulitis. Okay. Not diverticulitis. And then what was I going to say about that? You may have, let's heave, right? And a really fast upper GI bleed, right? Due to what? What's a really, really fast, prominent upper GI bleed? Because it doesn't spend 6 to 8 hours in the GI tract to get melanized. Maybe ulcers, but it's going to be very prominent with a really, really fast, high pressure system that's bleeding out. Good. You have varices, right? Right? You can have rectal varices too. So that could be also another reason, right? But if we're talking about upper, that's a B esophageal. Okay. All right. B. What was B? Chest pain and shortness of breath. It's a nope, right? This would be for an advanced, right? Stage 3, 4, whatever. Hiatal hernia, right? Right, not a abdominal, or could we say inguinal hernia, right? And then C, inability to push intestines back into abdomen. That's a yes, that's a correct, right? Because why? This indicates it's one of two things, right? It's either incarcerated or strangulation. Okay, and then which are complications, right? Reducible is just like it's worrisome, but it's not going to cause problems, okay? And then bowel ischemia, is that a complication? Yes, right? Correct. If it said large bowel ischemia, that'd be incorrect, right? But I just said bowel ischemia, right? And don't put too much word into it. Don't say, oh, the B is capitalized. You must meant large, right? That's not what I'm not trying to trick you, okay? So this, it's a small bowel often gets trapped, right? And ischemic, especially with SIR, right? So strangulation, incarceration, rarely reducible. Because you might be able to reduce it back in the bowel, but you might have been like twisted and volvulus, right, back in the bowel. All right, but again, I'm testing you on the common stuff. I'm not testing you on rare things. Okay. All right. What else is I going to say about that? Okay. So E. What was E? Bloody diarrhea. I already kind of said if hematochezia is wrong, bloody diarrhea is probably wrong too, right? So nope. This is. Yeah, this is hematochezia, but this is describing. What do you think? Who has bloody diarrhea? So I'm thinking we have to do inflammatory bowel disease next, right? Because this is describing IBD, right? Ulcerative colitis has more bloody diarrhea than Crohn's, right? Crohn's. Okay, makes sense?
Yes.
So that's a hernia question, right?
Crohn's has like the pattern, right? Crohn's has the stones, like the cobblestone.
Mm-hmm.
Like cobblestone. Is that what you're talking about? Yeah.
Yep.
That's all I can remember Daniel saying.
So we have the hiatal, or we did abdominal, we did inguinal over here. Okay, and again, it's the same things here. You can ask any one of these things. What are the interventions? What are the complications? We did a question on, right? What are the causes? Okay, cause and interventions could be like teaching, right? Afterwards to avoid another hernia. Okay. All right. What else?
IBS versus IBD. Yes.
So IBS. Let's grab my template. Sorry. Okay. So which one? IBS or IBD? Or you want to figure it out?
IBD because it's more serious. Yeah.
All right. So yeah. So ideally you want to be able to compare and contrast the two, right? So nurse knows Crohn's disease is caused, treated, symptoms. What do you want? Diagnostic tests.
Can we do symptoms first? You want to do symptoms first? Yeah, so we just know what it looks like.
Has symptoms of. Okay. So let's throw some stuff in there, right? So let's say, lead pipe, physical, appearance on barium enema. Okay. What else?
Which one is the pencil?
Fistula.
This one?
And then we have pencil-like stools. All right. We have tenesmus. And we have what else? Cachexia. All right. So what are these things? A. Lead pipe appearance. Some barium enema. Is that a symptom of Crohn's disease? Good. So lead pipe. Ulcerative colitis. Where's a good one at? Okay, that's a nice one. It's probably one I grabbed before. Let's see if we get another one. That's the good one there. All right, so it lit up the bowel, and you can see how it's all ulcerated and it lost its shape, right? So we can say this is, whoops. All right, so that's a nope. All right, this is not a nope, this is ulcerative colitis, right? Lead pipe. All right, B, fistula between bowel and perinus. That's a correct, right? And Crohn's disease is known for fistulas. It's also rectal sparing, usually, but not the fistulas. Okay, what else has fistulas? Besides Crohn's disease, there's two disease processes we talked about that have fistulas. Cancer might, yeah. Esophageal cancer can, but more commonly it's going to be. No, it's not a fistula. That's a rupture. That's a perforation.
Oh yeah, it does that.
Diverticulitis. Very good. Okay, so PUD really has rupture into the abdomen. That's called perforation. Okay. All right. So C. C was pencil-like stools. That's a nope. Why? No? This is pencil colon cancer? Yes. So colon cancer, right? This colon cancer feature. Okay. Does UC cause colon cancer? And then they could get this. This is too far removed. Yes, but that's looking into it. But what doesn't Crohn's cause colon cancer? Yes, but again, stop. Okay, so D, tenesmus. Yeah, nope. This is a feature of ulcerative colitis, right? All right, there's a feature of ulcerative colitis where they have sensation of retained stool in rectum, right? Crohn's is rectal sparing. Thus, it would not have tenesmus. Okay, E, eczema. So just put cachexia, malnourished, right? Is that a yes or a no?
I think yes.
All right, correct, right? Why is it correct? My sister's boyfriend's dog has Crohn's. You said hard to eat, or?
No, it's the other one. It hurts to eat, so they don't eat, so they lose weight. Right?
Yeah, due to small bowel involvement, right? Where nutrients are absorbed, B12, folate, etc. Right?
So you can't absorb them? Is that why?
Yeah, you can't absorb vitamins, folate, B12. Therefore, you get anemic. Yeah, but you also get malnourished, right? You get you're not absorbing properly. Okay. So, and then large bowel is for what? Water absorption, right? Just drink more. Right, otherwise, but you can't help it if your small bowel is involved, right? Ulcerative colitis, they can drink more fluids and such. All right, they're at risk for dehydration. Both of them are at risk for dehydration. All right, does that make sense?
Yes.
So that's IBD. Okay. All right, what else? All right, so you do want to know the difference between IBC or UC and CD. You know the difference between IBD and IBS, obviously, right? All right, what about ulcers? Do you want to know? So, I mean, you do want to know, I mentioned last time, the study group, you want to know what the difference between duodenal versus peptic, right? Okay, so like LES, not LES, but that'd be more for GERD and hilar hernia up there, right? But what else would be for ulcers? It's going to be, the causes, right? Or what's damaging the stomach versus the most common cause, which is what? Sounds like a test question. Let's put it over here. All right, so let's put patient has gastric ulcers, right? Cause, right? So what are the causes? Let's say what? Not washing hands. Or let's put contamination from not washing hands. All right, so what else? Is it smoking? All right, so let's make it more fancy. Let's say that they have a use of ibuprofen for back pain. All right, what else? And what else? We have, what's another good answer? So increase intradermal pressure, let's say, right, increase in ascites. Right, and then steroid use for asthma or advanced asthma. Or we should say lupus, for lupus. Okay, so A, what is A?
Yes.
That's correct. Why is that correct? Right, this is how you get H. pylori. Okay, and then B, smoking.
I noticed that, and I don't know if it's right, but it impairs healing. But does it cause? Yes.
That's correct.
Okay.
Okay.
So it causes everything. So
Yeah, it causes everything. So it's, yeah, when in doubt, and it's going to damage it vasoconstricts for one, right? And you're reducing the blood flow to the stomach, right? So you just think of it that way, right? All right. And then what else? Use of ibuprofen for back pain.
Yes.
That's correct, right? NSAIDs cause, all right, are directly toxic to gastrum lining, right? And what else?
Inhibit prostaglandins, which are protective.
Okay. And then what else? Use of ibuprofen for back pain, increasing ascites. Why is that no? Sorry, I got 3. I got enough.
Yeah. Because the last one's right too. Also, yes, it can't be all of them, right? It could be all. It could be all of them. Increasing
So you wouldn't pick it, so you would have got it right. So that's, but what's the reason? This increases, right, intra-abdominal pressure, which causes, right, GERD, hiatal hernia and such. Okay, that's not related to this. Okay, and then steroid use for lupus. That's correct, right? Why? See above. Okay, so the gastric ulcer causes, right? So we can do one. Also, I think I've copied yet. So it's still in my copy bank. And then we could do differentiation, right? Gastric versus duodenal ulcers, right? So which one do you want to make the positive? Do you want to look for gastric ulcers or duodenal ulcers? Duodenal ulcers have what features, right? Let's just say what teaching. All right, and then we can put in some causes, treatments, all the other fun stuff. Okay, so make sure you wash your hands, right? Because that's H. pylori, right? What else do we put? So there's the table on the slides, right? That's basically all we're doing is asking, which one does it fall into, right? So pain is better with meals. Okay, what about let's say pain is worse with deep inspiration, right? And let's say increasing, let's see, fatty foods in diet will worsen symptoms. It's not really teaching. I got sidetracked. So pain, how do you make that a teaching thing? So just put what, right? Make it all over the place. Increasing fatty foods in diet will worsen symptoms. And what's another good one?
Like wrong or right?
It's up to you.
Likely to become cancer.
Likely to become cancer? Yeah, I mean they both can. Duodenal is more risk, or is less risk. Gastric is there at causing the problems, right? So say, I have nighttime insomnia due to pain, right? And so it has a, right, increasing vomiting. Let's put a complication. Okay, so A, pain is better with meals.
Yes.
Pain is better with meals?
Unless your slide is wrong.
So what's the rationale?
It says foods until 2 to 4 hours weight gain and antacids.
So duodenal ulcers, right? That's what we're doing, duodenal ulcers. So usually when you are squeezing out all that food from the stomach, that's when that's the acid hitting the ulcer. That's gonna cause problems, right? So it's usually 2 to 4 hours after eating, right? Is the slide wrong, or is that what it says?
It says improve with foods until 2 to 4 hours after. Oh, so well then no. So pain is better.
Pain is better with meals or worse with meals?
Immediately better. Yeah, immediately better than, and then later on no.
Good. So you have to figure out what side of the fence we're talking about, right? So are we talking about, is the pain worse with eating, right? That's going to be gastric ulcers. Is it improved with eating? That's going to be duodenal ulcers, right? So pain is better with meals, right? That means the stomach's no longer squirting out GI contents into the duodenum, right? Now it's going to focus on digesting itself, right? So this is a correct answer, right? Correct, right? Pain is better with meals, right? Worse with not meals or with fasting, right? And you can also say gastric ulcers are what? Worse with meals, right? Better with fasting, right? Because you're emptying out the stomach at that point, right? Does that make sense? All right, so pain is worse with deep inspiration.
No.
Why is it no?
Because it's so low. Yeah, like it's because it's like always no. If it was stomach bleeding, maybe. Well, there's the like spread.
So which one?
Me too. If it applies to ulcers. Well, it says epigastric pain.
So epigastric. I mean, it didn't focus on epigastric. Do we say anything about inspiration or expiration with ulcers?
That's what I was like. Not for good harms or anything to do with it.
So that's a nope. Why is it a nope?
Because it's not associated.
This is gallbladder pain, right? This is a Murphy sign. That's not a has nothing to do with ulcers. Okay. Hepatitis, right? Did I say gallbladder? Yeah, it's gallbladder too, but it is gallbladder. It could be hepatitis too. Okay. All right. C. Increasing fatty foods and diet with worsened symptoms.
Maybe because it causes more bloating. So maybe it's gastric. So maybe it's a no. But I don't know. Increasing fatty foods. Yes. That was yes.
It's a nope. Why is it a nope?
Because
So it might worsen GERD, right? Fatty foods can worsen GERD, but this can worsen GERD, right? Right, fatty foods relax LES, right? So it really doesn't have anything to do with ulcers, right? So ulcers, it could get worse with alcohol, it could get worse with smoking, which is wound healing as well, right? It can get worse with, what else did I say? With, with NSAIDs and steroids and whatnot, but it's not going to, fatty foods don't have any role, okay? Fatty foods, they do stimulate cholecystokinin, which makes your gallbladder contract and make your GI tract motility increase. So you could argue that as you're going to put secrete more gastric acid from the stomach into the duodenum, and that would worsen the symptoms. But that's looking way too into it. Okay. And then D, nighttime insomnia due to pain. Correct, right? Pain is, so 2 reasons. Pain is worse, right? 2 to 4 hours, right? After eating, hours. And with fasting, do you eat while you sleep? No, you're fasting, right? So that's why it hurts more at night. Okay? And there's probably some circadian piece to it as well, but the other piece is that these guys actually lose weight more than gastric ulcers, right? Okay, what else? D, that's D. E, may have melanotic stools. That's correct or incorrect? Correct. Why? Yeah, yeah. We're past the pylorus, right? Right, we're past the pylorus. It's hard to go backwards, right? So it's usually melena. GI tract. Oh, perfect. All right, so they're past the pylorus. They don't look like they're having fun.
No, they look very worried.
Okay, so yeah, so you're past the pylorus at that point, and it's hard for the pylorus. Once the pylorus is shut, it's really hard for it to back up. Okay. All right, good. What else?
Better.
Feel better? Pancreatitis? Like acute versus chronic or what?
Yeah.
Right, but again, everything's always going to be these things, right? You're looking at all the different possible causes. So like I get smashed is a good SATA, right? That's a good SATA to be asking, right? And so you want to do an acute versus chronic question?
Yeah. I know there was a lot.
Okay, so which one do we be answering, acute or chronic?
Acute.
So acute pancreatitis has these symptoms, right? Or you want to do symptoms or a diagnostic test or?
Yeah, it's up to you. You want to listen to symptoms?
These symptoms, findings, right? So what symptoms, findings would they have? Or do you want to just make it up as we go along, right? All right, so you can do Trousseau's sign. You can say positive AFP, right? You can say positive lipase. You can also say they have, what's another good one? They have steatorrhea. Yeah, I'd say malnourished. Malnourished appearance. Okay, so what is A? Epigastric pain rated at the back. Yep, it's classic, right? Classic pain. Acute and chronic pain. Right? And then Trousseau's.
Is that them? Is that no, maybe that's asterisk. That's asterisks. Yeah, that one's asterisk.
So we can get this one, and then we can have other hand stuff. Let's do Trousseau's. What is that? Why is that Trousseau?
A bridal shop. Wonderful. Oh, that's that one. Okay. Is that when you have the blood pressure one? And that one's also hypocalcemia.
Trousseau's, and then what's another one? Another hand thing.
Another hand thing? Yeah,
All right, so which ones are these? Crop. Okay, so is this correct or incorrect? Why is it correct? Can result from acute pancreatitis, right? Not chronic, but acute panc, right? And leading to Trousseau's. And if you don't know what Trousseau's is, then you can put it BP cuff, right? Causes what? Contracture, right? Hysterexis is what? Is flapping, right? Due to what? Yeah, cirrhosis and HE, right? Hepatic encephalopathy. And then there's also cirrhosis can also has hand stuff. Contracture. Like Dupuytren's contracture and such, right? But that's just so you know the hand stuff, right? And this is jazz hands. All right, so then what is C? Positive AFP.
Is it the alpha?
Alpha fetoprotein.
We did this on a different question. Is for FB, so no.
So that's a nope, right? So this is for Hep B. Hep no. Hep C, Hep no. Liver cancer, right? For Hep stuff, right? Hepatocellular carcinoma. All right, that's for hepatocellular carcinoma. And then D, a positive lipase. That's correct, right? Why is it correct? Are spilled in the bloodstream, right? Right, because you're digesting the autodigestion of the pancreas, and then it's going to digest into the capillaries, and it's going to leak into the bloodstream. Mm-hmm. Okay, and then E, malnourished appearance. So it's a no way. Nope, this is for chronic pancreatitis, right? Because they have why? They lack enzymes, right? To digest, right? Fats, carbs, and proteins. Therefore, they are deficient in carbs, fats, proteins. Carbs, proteins, and fats. Fats absorb what? Vitamins, vitaminos, right? So they need to have what? They could get vitamins supplemented, or you could give them, you can start at the source, so you can give them what? You can give the enzymes themselves, right? That's what kind of therapy is that called? It's like Pantene Pro V, PERT therapy, PERT, right? Pancreatic enzyme replacement therapy is for chronic pancreatitis. Okay.
Before meals.
Doesn't make sense to be after meals. It has to be before meals, otherwise you're not going to digest it, right? Okay. So that was acute pink versus chronic, I think. Okay. Anything else on these guys? Anything else on these ones? Did you want another different questions?
So, what kind of things would you test on every push? Would it be the meds?
Yeah, the meds can be, like we've done some meds already, right? So for example, so I pushed cardiac meds. We didn't do any GI meds just yet, but knowing the side effects for them and knowing what they're for would be a good way to start, right? Like pantoprazole is for what? Mm-hmm. Yeah, for ulcer disease, right? Peptic ulcer disease. It's also for hiatal hernia and GERD, too.
You checked off with that one, not me. I didn't do well.
All right, so yeah, the ibuprofen meds, you're gonna know, what the indications are, for just like in general, right? So med specific. stuff, but then there's indications for IV push. Why do you need to give IV push medications versus a PO medication?
Faster absorption.
Yeah, there's faster onset, and there's what else?
If they're MPO.
Good, they've got no worky, right? So, or they're MPO for some reason. Okay, so there's that'd be a good reason to give IV push. And then your indications, and then contraindications. That's not contraindications, but complications, right? As we talk about the slapping and the extravasation and the vesicant properties and such. Okay, and then the procedure. How do you do it, right? Are you pinch pausing? Are you flushing rapidly after you give it? No. Okay, so that's the idea with that. Right, and you guys saw the study guide, right? The study guide, I think we went over IV push stuff. Mm-hmm. So here's the study guide right here, student exam 1 study guide. All right, so let's look for push. All right, so there's the IV push stuff. I think it's pretty comprehensive. I don't know if there's anything else you need to put on here.
Yeah. Can we do one more EKG question?
Mm-hmm. Another EKG question.
It's not gonna take the 2 hours. 2 hours for the 2 questions.
All right, so what kind of EKG question do you want? You want symptoms, treatments, causes?
Which one? What do you want the last one? I think we did treatments. Oh yeah, because we did what would you do?
All right, you want a lethal rhythm, a Brady rhythm? We haven't done pacers at all.
Oh, we can do pacer.
So let's find a pacer. So don't look, let's find one that's paced. Where are my pace rhythms at? Let's see. Oh, they'll be all over here. Left my mouse at home, so it's like struggling to drag and drop. All right, you can look now. All right, so that's super light. I'm going to change the properties. Make this darker. Contrast. No, that's the wrong way.
No.
That didn't work at all. I'm looking for saturation or something. No, passing. I can't do brightness. That didn't work either. All right, that failed. Anyways, so this is a patient has this, right? This rhythm, and has a implanted pacer on their chest wall, left chest wall. What up? Okay, so what's going on? So we'll make this a SATA, and what up? What you do? Okay. So what up? Let's do that. What are possible causes? Okay, so failure to what? So we have pace, failure to capture, and then we got to. This would be a good close question, actually, right? So you do have to answer either one. You know what I'm trying to say? So let's do A, B, C, and then D, E, F. Does that make sense? So failure to pace, failure to capture, failure to sense. All right. So patient has this rhythm in the chest wall. This is interpreted as A, B, or C. Right? So you're selecting one of those 3 options, right? And it is likely caused by, right, D, E, or F. Okay. What up is still good, still valid. Okay, so does that make sense? So this is it's called a closed type question where you drop, there's gonna be a little drop down list. You're gonna see A, B, and C, and you can see a drop down list for D, E, and F. So you select 2 answers, right?
I just don't have to take it.
One from A, B, C, one from D, E, F. That makes sense, right? It'll be able to drop down. Okay, so you got those 3 options for your drop down, and then we got 3 causes, right? So we can do sensitivity is to what? Now these have to be, it's not a SATA, so it can't be the same thing, right? Too high or too low?
Too high.
Now we're like doing a meta thing here because you're trying to do the right answer or the wrong answer.
Oh yeah. Oh, wait. No.
If sensitivity too low, where's your fence at?
Wait. If it's too low, you wouldn't sense. Or if it's too high, you sense everything. Too much, yeah.
If sensitivity is too high, right? That means you're sensing everything, right? So your fence is too high when it's your sensitivity is too low, right? It goes opposite. Okay, and then we'll put some fences in the rationales. All right, so then we got to E. So let's do some. I don't know, scar tissue and myocardium and pacer. Right, we can also put down pore contact. That could work too, actually, but let's put the opposite then. Let's put patient is hypokalemic. Okay. So A. So A, B, and C, rationales. We're going to add a rationale for F, right? Let's just kind of color code this. Let's fill this. That's not the right one, I don't think. That's the text, not the table. Oh, there it is. Okay, so let's fill the color in with the first half, and the other half is the DEF, right? So what is the failure to pace, capture, or sense? Right, this is correct, right? Why is it correct? Because
there's no spike.
No pacer spike. This is failure to pace, right? And this is incorrect, right? Nope. Because why is it not failure to capture? There would be pacer spikes, but no response. Okay, and then C of B is nope, because we said there's only one correct answer, right? It's failure to sense. Why?
Because there's no pacers.
Nope, right? Because there's no pacer spike, right?
Nothing to sense.
Right? And there are pacer spikes. Does that make sense? Does that make sense? All right, so D, E, or F. Sensitivity is too low, scar tissue is their scar tissue, or they're hypokalemic. So that's the correct answer. Why is it correct?
Because if it's too low, it's not. Wait, yeah, this is.
That is too low, right? Means it is a boyfriend who does not care. Okay, so the fence is too high. Okay, the fence is too high. The emotional walls are too high. Does that make sense?
Wait, the emotional walls are too high. So, since your walls are high, then it can't sense anything.
Let's do a fence here. Let's make sure they labeled it right? So low sensitivity, high sensitivity. Nice. All right, so let's grab this one. Actually, yeah, low sensitivity, right? So the walls are too high, right? So the boyfriend doesn't care, okay? Does that work? Or this guy's too sensitive? Okay. What's going on there? What's wrong with her face? Anyways, all right, so this is where they don't care, right? So he just doesn't respond, he ghosts her, he doesn't respond to anything, right? So his sensitivity is what? He has low sensitivity, right? Fence is too high. Does that make sense? I keep saying sense, I don't mean to have so many puns. Okay, so that's he's low sensitive, he's not sensitive. Okay, whereas someone has high sensitivity, they're really overactive and they are going to see every single thing, and they're going to be, it's called a failure to what? Sense. Okay, and then E, scar tissue and myocardium. Nope, this is failure to capture. Right, failure to capture, right? Impulse is seen, right? Generator is working, and on EKG strip you see spikes, right? And but impulse gets absorbed, right, by scar tissue and doesn't capture heart. Does that make sense? Let's see, pacer, scar tissue. So, where's a good one? I need like a drawing. That's the smallest drawing ever. All right, again, I can draw on this. Okay, so let's put it, this time it never worked out before. Oops, the boyfriend, girlfriend. Let's copy this image, let's paste it there. And scar tissue. So let's put some scribbles right here. Why can't I scribble? There it is. All right, so I have some scar tissue on this area right here. There's scar tissue, right? So I have scar tissue that's getting in the way. Okay, so the impulse is coming down here. So let's create the impulse. Let's do an arrow. All right, so it's coming down here. Let's make that bigger. Let's make it impulsy, like a yellow color. Let's make that thicker. All right, it's coming there. That's too thick. All right, and then it's going down here. Right, but then it gets blocked. Right, not all the impulse gets through. Okay, so some of you'll see the capture, you'll see that impulse, right? But you won't. It won't. Not all of it will be enough to capture the heart. Okay, so on what F, right? So what is F? That was hypokalemic. It causes arrhythmias, yeah, and you could say it's unrelated. It is related to failure to sense because they have like a hyperactive myocardium. Myocardium is very, very irritable. Anything can make it go off, right? So yeah. So it's nope. This causes a easy to stimulate myocardium. Could be seen with failure to sense. Okay. All right, makes sense. All right, that's pacer stuff, right? Is that what you want in pacers, or you just want another EKG practice?
That's fine. That makes sense to me, yeah.
Okay.
But for some reason, that lecture really stuck. But I don't know why. I was like dead tired, and I was like, let's try to hang on for my life. But
Yeah, and you're watching a Dodger game too, so.
I know, it was like, yeah. I did turn on like Subway Surfers. Oh yeah, I did. When I came in, she was like watching somebody play Subway Surfers.